Can the penal system handle a COVID-19 outbreak? The Bordelais Correctional Facility has confirmed the presence of the virus at the prison complex. According to Director of Corrections Hilary Herman, the highly secure facility first witnessed the introduction of the virus among staff in the kitchen, to be precise. Now, 8 inmates have tested positive for COVID-19. Herman says the health authorities conducted contact tracing efforts on the weekend and the results are pending. In light of the threat, can the prison endure a shutdown?
We're as tightly shut down as we possibly can. There's no inmates going to court. Everyone is staying within, and that has been like that for months now. We've attempted to do virtual visits, and we allow family members to make drop-offs to the inmates. So I don't know how much more of a lockdown that can be done. Staff have to continue coming in and out to work, and that's the only movement we have.
A now viral online video shows some inmates at the facility leveling a number of allegations at authorities concerning the potential threat of the virus to the prison population. In the video, the inmates can be seen skirting COVID-19 guidelines and sharing paraphernalia.
The authorities cannot inform us as prisoners up to this date as to what is really taking place in the prison. All we can see, we can just clearly see movements of people going around with corona gear, corona equipment or whatever it may be, and we as prisoners, they never come to teach us any precautionary measures. They never come to, no medical practitioners never been to us and tell us, well, such and such is the case, well, we need to abide to these things, or we need to use protocol or whatever it may be.
The Director of Corrections notes the fears and anxieties of the prison population.
Those videos are obviously not condoned by us, but however, what you see in this video is inmates that are scared, high level of anxiety, and they're concerned. However, we continue to update them on what the virus is doing. But as you know, unless you have the CMO herself come out to the prison and explain to them, they probably will not be satisfied.
Officials have kept close tabs on prisons in the region which have suffered similar fates. In early January 2021, over a quarter of the prison community in Barbados had contracted the virus. Likewise, a spike in cases in Trinidad and Tobago back in November 2020 caused a stir among corrections officers and prisoners there. Meanwhile, St. Lucia's acting national epidemiologist, Dr. Dana Da Costa Gomez, reveals that the positive cases were found after 35 individuals in the prison system were tested.
In response to recommendations from the Ministry of Health and Wellness, the following actions have been taken in the interest of containing the spread and protecting the health of staff and inmates at the facility. Complete isolation of confirmed inmates away from the general population. Quarantine and testing of close contacts of the confirmed cases. On Saturday, January 30th, 2021, samples were taken from a total of 86 individuals, 79 inmates and 7 custodial staff. The Ezra Long Laboratory is currently processing these samples.
Dr. Gomez says strict infection and prevention control measures will be enforced in the wake of the cases.
Isolation of any symptomatic inmates. Placing of exposed inmates into a limited number of areas whilst establishing effective barrier controls between them. Protective measures for inmates who fall into high-risk categories. The use of adequate personal protective equipment by the healthcare staff and custodial staff who will be caring and working with the quarantined and isolated individuals. Limitations of the movement and interaction of custodial staff overseeing areas with inmates. The strict adherence to hand hygiene measures. Continued use of face masks by staff and inmates. The frequent cleaning of high-touch objects and surfaces. the testing and quarantine of all symptomatic custodial staff.
Public health officials vow that the situation will be monitored and assessed continually to ensure containment of a possible outbreak. Solange Alfred, HTS News Force.